Okay. Hi, everyone. My name is Dr. Bhavik Sheth, and I'm a physical therapist, and I specialize in working with orthopedics and sports physical therapy. But one thing that I learned from working with hundreds and hundreds of patients of mine, then they would be for sciatica, for neck pain, for knee injuries, for arthritis, for really common injuries that a lot of people have for pain. But a lot of these people had other medical conditions that were also improving when they were exercising and doing physical therapy. So today's topic is going to be about diabetes and how physical therapy can really help you manage and improve or even prevent diabetes from occurring. And that's what today's topic is going to be about. So we're going to spend some time learning about what diabetes is. We can learn what can happen if diabetes is not managed properly. And then I'm also going to teach you like the most scientifically proven and research supported treatments for improving diabetes. Okay. So the main thing to know about what diabetes is before you start doing anything about it is to really understand what diabetes is. So diabetes is a condition where your body is not managing blood glucose levels properly. And what that means is anytime you eat something, your body breaks down and digests all of the food. And one of the main products of that is glucose. So glucose is needed by all the cells in your body in order to create energy and to do something productive with. It's also used by your brain. Your brain is the biggest source, biggest organ in your body that uses the most glucose. It's also used by all of your muscles and then all of the other little cells in your body to do its job. So if we didn't have glucose in our body, we would not be alive. Okay. But what happens when glucose is not managed properly is what we're going to talk about today. Okay. So there's two main types of diabetes. One less common type of diabetes, and we're going to talk about type 2 diabetes the most today. So type 1 diabetes is the first type. It's more rare, less common, but that's when your body is not creating enough of the hormone insulin in order to regulate the blood glucose. Okay, so what insulin is, it's a hormone that is secreted by your pancreas, and its job is to take the glucose that's in your body and helps to bring it to the cells in your body. So if you have glucose in your blood and you don't have insulin, that glucose from your blood can't enter your cells and it can't enter your brain. It can't be used. So the glucose is just being circulated through your whole body through the blood and not being used. Um, type 2 diabetes is what we're going to spend a lot of time talking about today. So we'll get to that in a minute. But also something that's very common is called gestational diabetes. And this is something that a lot of women who are pregnant, they develop. They can have diabetes during their pregnancy, and that could lead to a lot of complications for the mother and also for the child. So this is something that, a lot of women, I really urge you to talk to your doctors about this because it does happen. You can have complications after the pregnancy as well. But type 2 diabetes is the main thing that we're going to talk about today. And this is by far the most common form of diabetes. And this type of diabetes has nothing to do with your body not producing insulin. So we have all of the tools in our body to manage the blood glucose. But with type 2 diabetes, our body is not doing a good job of using the insulin it's already creating and using it properly. So what does that mean? It's that you have glucose in your blood, you have insulin in your blood, but the insulin is not working properly to take the glucose and put it to the rest of your body. Okay, so this is what type 2 diabetes is. And this is by far the most common form of diabetes that a lot of people experience. So what are the risk factors? Who are the people that are most likely to develop type 2 diabetes? Um, so it's usually found in people the age of 45 or higher. Um, Race is also a big part. So genetics, so if you're Black, Latino, Asian, um, Native American, Pacific Islander, Indian, all of these races also have a higher chance of developing diabetes. It's also genetic because if your parents, your brother, your sister, your family, if your family has diabetes, that's also really likely chance that you will also develop diabetes. If you are overweight, if you smoke, if you're not physically active, if you have high blood pressure or taking medication for high blood pressure, if you have high cholesterol, high triglycerides, if you've had diabetes during your pregnancy, or if you've been diagnosed with a condition called polycystic ovary syndrome, all of these are risk factors of developing diabetes. Okay, so even just from our group, with a show of hands, who's over the age of 45? So just raise your hand if you're over the age of 45. So there's going to be a lot of people here. How many people here has a family member, a parent or a brother or a sister with diabetes? Raise your hand if you have either a parent or a sibling with diabetes. So again, a lot of us have siblings with diabetes also. How many people here have high blood pressure or a high cholesterol? Raise your hand. So again, a lot more people have these conditions. So this is all part of the risk of developing diabetes, okay? Now, like a lot of things, like a lot of other conditions that are not managed properly, it's because you don't really feel that you have diabetes, right? And that's sometimes the hard part, because a lot of times you don't know that you have diabetes. A lot of times people feel normal, they feel fine, they feel like they're healthy, and they could have type 2 diabetes where the body is not managing the blood sugar properly. And that's the problem that I see a lot. In the clinic, I've seen this with people with high blood pressure. They don't know that they have high blood pressure until they have a heart attack or a stroke. People don't know they have diabetes until they can have a really bad medical condition that could happen because of that. So this is something that it's hard because the symptoms are not very obvious. And like if it's something like if my shoulder hurts and it hurts and it hurts, like it hurts to lift my arm, that's a very obvious thing. I'm gonna go get that checked out. But we don't really feel diabetes the same way, so we don't get it checked out. And that's the main thing I want to talk about today. It's like if you're over the age of 45, over the age of 40, over the age of 35, you should be seeing your primary care doctor at least once a year just to get your blood values done. So they can look at your blood sugar, they can look at your cholesterol levels, they can look at your blood pressure, all of these other things. If you start looking at it and your doctors start looking at these things early, then they can catch these signs early. So then it's easier to treat and fix later on. Okay, so how many people in this group had their blood values taken when they were like 30, 35 years old? How many people here, when they were at that age, they went to the doctor every year? Right? Very few people. Very few of us went to the doctor at that age until we saw something bad, then we go to the doctor. Okay, so that's the one thing that, again, afterwards in the question and answer portion, I want to talk a little bit about also. We should start going to our doctors to be healthier rather than going to our doctors so we can be less sick. We want to be healthier. That's what we want to try to do. Okay. So going back to diabetes, what are the symptoms of diabetes? And the answer is there really aren't any obvious symptoms of diabetes, but there are certain signs that you can look for to see if diabetes is something that you might have. Okay. So some of the common signs are frequently urinating, feeling very thirsty or hungry, even though you just drank water, or even if you just ate, you might feel thirsty or hungry. If you feel really tired, if you feel tired all the time, that could also be a sign that you have diabetes. If you have blurry vision, if it's hard for you to see properly, or if you feel like your vision is slowly getting worse, that could be a sign of diabetes. If you have a cut, a bruise, or a sore, and it's not healing fast or it's not healing properly, that's a main sign of diabetes. Like a lot of times people will have a cut on their arm and it takes so long for it to heal. It's because of diabetes usually. Or if you have tingling in your fingers and your toes, that could also be a sign of diabetes. And now all of these things, you can see how we can confuse it for other conditions, right? If you have blurry vision, sometimes you might just think, oh, it's my eyes just getting weaker. I need to go to the eye doctor. So we get your eyes checked and they fix your eyes, but they don't talk about why your eyes were becoming blurry in the first place. It could have been because of the diabetes. And something I see a lot, if people have tingling in their fingers, sometimes they think it's related to carpal tunnel syndrome. Sometimes they think it's coming from a disc in their neck or their back, and they think the tingling in their fingers and the numbness in their hands is coming from like sciatica, but it's not always related to that. It could also be because of diabetes, okay? And my main point in this is with diabetes, just like with heart disease and hypertension and high blood pressure, we don't always feel that we have the condition. But that's when it's very important for us to do regular checkups with your primary care doctor so they can screen for these things before it turns into something bad. Okay. So how does your doctor diagnose you with type 2 diabetes? What are the things that they look for? And before I started talking, I was listening to some of the people here talking, and it sounds like you guys are some people in this group are getting checked. And one thing I think that's important to know is yes, diabetes can go away. That is true. You can develop type 2 diabetes and you can change a lot of things, and the type 2 diabetes can go away. Okay. But the way to diagnose it is by these three main tests that they do. Okay. And this is all either done in a lab or your doctor's office. So the first thing that they look for is your A1C. All right. So the A1C, it's like an average value of the blood sugar in your blood glucose levels in your body. So if you have an A1C number that is less than 5.7%, that means you're normal. So your A1C needs to be less than 5.7 to be normal. 6 is not normal. Okay, just so we have that clear. People think that, oh, my A1C is 6, that's fine. No, that means you have pre-diabetes. That means you're this close from developing diabetes. Okay, if you have an A1C higher than 6.5, that means you have type 2 diabetes. You have the diagnosis of type 2 diabetes. If you're anything in between 5.7 and 6.5, you have what is called pre-diabetes. Okay. The other number that you can look at is called your fasting plasma glucose. So this is the other blood test when you get done. You're not supposed to eat, until the night before. Like the night before, you have to stop eating. Don't eat in the morning. You get your blood values taken. If your blood glucose is less than 100 milligrams per deciliter, that means it's normal. If it's greater than 126, that's diabetes. There's anything in the middle, that's pre-diabetes. There's another test called the OGTT, like the oral glucose tolerance test. And this test is when they look at your blood glucose in the beginning, they give you like a sweet drink, and then they wait 2 hours, and then they check your blood glucose again. Sorry, they check your oral glucose again. And the normal values are less than 140, and anything over 200 is diabetes. Anything in the middle is pre-diabetes. So these are the numbers that I think it's very important to know and very important to think about. One thing that I keep on hearing is, oh, I have 6.1, I have 6.2. That means I'm good. That does not mean you're good. That means you're not as bad as it could be, but you're not healthy. An healthy A1C is less than 5.7. All right. And what does that mean? If you have like a 6.1, 6.2, what can happen to me? What's going to happen to my health? What's going to happen to the rest of my life? And this is the one reason why I wanted to talk about this today. When I was in physical therapy school, doing a lot of research related to a lot of cases, I started to see how disruptive diabetes can be for your whole body, not just directly related to your blood glucose. It can affect your entire body. It can affect your eyes, your ears, your brain, your muscles, your nerves, your kidneys. It can affect everything. Diabetes can affect every single part of your body, every single organ in your body. So from my point of view, this is one of the worst medical conditions to get diagnosed with. Getting diagnosed with diabetes is one of the worst things that can happen to anybody. Okay. And that's one thing that I want to talk about today. What are the other things that can happen? Um, what are the other medical conditions that can happen because you have diabetes? All right. So the first one of like the complications is called neuropathy. And what neuropathy is that nerves in your body, either in your fingers, your hands, your toes, they stop working properly or they get damaged because of all of this extra blood glucose. And they can get damaged, and you can develop nerve issues like neuropathy. Some of the things that people feel like with related to diabetes, which is called diabetic neuropathy, is that when they're standing on the floor, they feel like they can't really feel the floor properly. Or if they're holding something in their hand, if they're holding something, it feels a little different than they're used to it feeling. So your things can feel different in your hands and things can feel different in your foot. One thing that I've seen in the clinic a lot is people with diabetic neuropathy, they don't feel that they have diabetes or they don't feel their toes properly. So they might have like a rock in their shoe and they might be there for like 2, 3, 4, 5 hours and they might start bleeding. They might have a cut. They might develop a sore in their foot and they never knew about it. Another thing that I see from diabetes is people having injuries in their toes and their body can't bring enough blood to heal that area. And they get a cut, they get injury, it becomes a gangrene, and they have to get it amputated. So a lot of toes that are amputated in the hospital is because of diabetes. Gangrene and other things like that, a lot of times happen because of diabetes. So that's one major thing that can happen. Other skin infections, like I said, like you can develop sores, you can get discoloration in your skin, um, you can get infections, redness, anything like that related to the skin. That's also a major complication of diabetes. Um, Vision, if you have glaucoma, if you have cataracts, if you have any kind of blurry vision, that can be because the diabetes is causing like the little blood vessels in your eyes to become damaged. And if there's not enough blood reaching to your eyes and other parts of your body, that part of your body is not going to work properly. So even just last week, one of my aunts had surgery to remove, I think she had cataracts in her eye, so she had a surgery to remove that. Glaucoma, again, very common thing that is something that people have, but sometimes they don't always realize that the glaucoma or cataract happened because of diabetes or pre-diabetes. Okay. Kidney disease. This is something that I see a lot of patients right now. They have to go to dialysis, 3 times a week because their kidneys aren't working properly. The kidneys is a major place where so much of your blood gets filtered. There's a lot of blood vessels in your kidneys, and diabetes is directly damaging these blood vessels. So it can directly damage your kidneys and other vital organs, and you can have kidney disease because of diabetes or pre-diabetes. Um, Also, things like infections, getting sick more commonly, having a urinary tract infection, things like that, getting infections commonly or getting sick commonly is also a very common complication of diabetes. Things like hearing impairments, if you're losing your hearing or hearing is getting worse over the years, that doesn't always mean you're getting old. That could mean that you're getting old and you're also having diabetes for a long time or pre-diabetes for a long time. So your hearing is worse. So all of these things are very, very related to diabetes. And a lot of times diabetes causes all of these things to happen. And we're not even done. There's still more. Heart disease, strokes, high blood pressure, coronary artery disease, where there's plaque being built in your heart, in the arteries of your heart, that can also be caused by diabetes. Dementia, Alzheimer's, depression are also related to diabetes. So having diabetes or pre-diabetes, meaning if you have an A1C greater or more than 5.7, if it's 5.8, 5.9, 6.0, 6.1, 6.2, 6.3, 6.4, that is still putting you at risk of developing all of these things I just talked about. So things from your eyes, your skin, your hearing, your fingers, your toes, your brain, all of these, your kidneys, all of these things can be directly and negatively impacted because of diabetes. So this is one of the reasons why it's, my life mission. I never want to have diabetes. I never want to have pre-diabetes. I never want to do that because it can affect my entire body and my brain. So what are some of the things that we can do to improve if you have diabetes? What are some of the things that you can do to cure or improve your diabetes? I think the thing that people think about or talk about the most is diet, and diet is very, very important to improve your diabetes. And I think, before I give anybody any advice on diet, I think it's very important to talk to a professional about this. So you should see a registered dietitian so they can figure out what is the right diet for you and your lifestyle to make you the healthiest as possible. Okay. So just like you wouldn't go to your doctor and ask them a question about your taxes. You wouldn't go to your accountant and ask them a question about, about like knee pain. You wouldn't talk to your accountant about knee pain. You shouldn't talk to, a physical therapist about your diet. You should talk to a registered dietitian about that. I think they can give you the best advice. So now, generally speaking, eating food with a lot of sugar, a lot of processed foods, things with unrefined carbohydrates such as white sugar, white flour, white rice, things like that are really they elevate your blood glucose levels really fast, and that's not a good thing if you have diabetes or pre-diabetes. So eating things are less less carbohydrates like that, less rice, less rotis, more vegetables, more protein, more healthier whole foods, less fast food. Going to Taco Bell a little bit less is probably good for your diabetes. Things like that are really good. Now, if you have diabetes and you're not able to manage your blood glucose levels properly, there are medications that your doctor can prescribe to help. They might give you insulin. They might give you like other things like metformin. They might give you other medications that might help your diabetes. So like that is something that you can also talk to your doctors about. But the thing that I think is the most important, and it's not because I'm saying it, this is because the research is saying this. This is like hundreds and hundreds of studies that have been done throughout the world, and they talk about the best thing that you can do for diabetes is losing weight. Okay, so more than dieting, more than medication, losing weight and physical exercise and physical activity is proven to improve your pre-diabetes and diabetes and actually lower your blood glucose levels. Okay, and this is something we don't talk about. If you have diabetes, everybody talks about food. Everybody talks about no more sweets, no more ice cream, less rice. That's what they talk about. That's all they talk about. But very few people talk about losing weight and exercise, even though this is the most proven treatment for diabetes and pre-diabetes. So there was a study that I think this is awesome. If you have diabetes, type 2 diabetes, you can lower your risk by 58% by losing 7% of your body weight. Okay, if you lower your body weight by 7%, so for example, if you weigh 150 pounds, if you lower your weight by 10 pounds, you can lower your risk of getting pre-diabetes or diabetes by 58%. Very few things in medicine improve your odds that much. Okay. If you exercise, if you do moderate exercise for 30 minutes, 5 days a week, so 150 minutes of exercise a week, that can also lower your risk by that much. So imagine a combination of exercise, and a combination of exercise and a combination of weight loss, that can really improve your diabetes conditions by around 60%. So that I think is amazing. And exercise is a great way to lose weight. Dieting is a great way to lose weight. Um, Strength training is a great way to lose weight. So you can lose weight and get the physical activity all at the same time if you exercise. Okay, so that's what I think I really, really want to spend a lot of time talking about and really inspire and educate everybody here. I talked a lot about all the bad that can happen from diabetes, what diabetes is, all of the other complications that can happen. It can affect your brain, your eyes, your ears, your skin, your feet, your kidneys. It can affect everything. And the way to fix it is by exercising 30 minutes a day, 30 minutes a day. And by exercising 30 minutes a day, you'll get stronger. You'll be more active. You'll have less physical pain in your body. You'll lose weight, which is really good, and your diabetes and your blood glucose levels will improve. So again, I'm going to say this as many times as I need to. When people talk about diabetes, they don't talk about exercise and weight loss. Weight loss and exercise is the most proven, useful, and beneficial thing for diabetes more than anything else. More than anything else, losing weight is going to be more important than completely changing your diet. Losing weight and exercise is going to be more long-term solution than taking medication. And one thing I talked about during one of our other presentations is the more you exercise and the more strong your muscles become, the more sensitive insulin is. So your insulin that your body is generating works better if you exercise and become stronger. So this is like the main thing that I wanted to talk about. And what are some of the exercises that you can do? And this is the question that I think is very important to talk to a physical therapist about, because the way I exercise my body is different than how my brother exercises his body, is different than how my wife exercises her body, is different than how my parents exercise their body. It's different for everybody. I have patients who are 70, 75 years old who are more fit and more flexible than I am, right? So they're doing exercises that I can't even do. And I have other patients, like for me, I have so many knee injuries. There's certain exercises that I can't do properly because it hurts my body. So I exercise a little bit differently, but I need to exercise to maintain my healthy lifestyle and so I can prevent getting diabetes in the future, because I love ice cream, I love mithai, I love eating, and I want to make sure I can eat when I'm 40, 50, 60 years old. So I need to exercise now so that my blood glucose can get managed now. So I got my blood work done like 2 months ago. And every year I'm going to get my blood work done, every single year, no matter what, just so I know that there's nothing going on. If my A1C starts going up a little bit, it's going to tell me, hey, I need to either exercise more, I might need to lose a little bit of weight, I might need to change my diet a little bit before it gets bad. Okay. So for some of the people here, what are some exercises that you can do? Number one, you should definitely talk to a physical therapist or your doctors about what are safe exercises for you to do, because if you have heart conditions, if you have other orthopedic conditions, we don't want you to exercise and get hurt so you can't exercise more. But something simple like walking fast 30 minutes a day is a good place to start. The best thing to do is strength training, to make your bones, your muscles, your heart, everything stronger. But that, you should talk to a physical therapist so they can design an exercise routine for your body and your condition. So you can exercise for 30 minutes a day and feel good and more energetic doing it. Um, so like that's some of the things that you can do. And like something as simple as fast walking can help a little bit. losing weight can help a little bit. And the best way to lose weight is by strength training. All right. So, like one example of a strength training exercise, and I show this all the time, is squatting. So, doing squats, so like standing up and sitting up and down. So, if you do this exercise, I'll do it like 12 to 15 times, and I'll do it 4 to 5 times a day. This is a great way for my legs here to get stronger. It's a great way for my legs down here to get stronger. It's a great way for my stomach muscles to get stronger. So this is like just one exercise that I do probably 2 to 3 times a week to strength train. And this is great for my knees, great for my hips, great for my back, great for my ankles, but it's great for my heart. It's really good to help my diabetes and my blood sugar to be managed. So it's more than just exercising for your muscles. And I think that's the important thing I want to teach everybody today. When you're strength training, you're not only getting stronger and making your muscles healthier, you're making your heart healthier. If you have diabetes or pre-diabetes, it's making your diabetes less. It can cure your diabetes. It can also reduce or prevent your diabetes from forming in the first place. Um, so that's what I wanted to talk about today. That's the whole presentation. I hope this was valuable to you. And if anybody has any questions, please raise your hand and let's start answering some questions.
Yeah. Can
I can't hear properly.
Hello.
Hi, yeah, sorry, I got disconnected.
Oh, okay.
so can you ask your question again, Andy?
Yeah. My question is you talking about neuropathy diabetic.
Hmm.
And now that is tingling in the feet.
Hmm.
How we can solve that problem?
Yes. It's tingling in the feet and it can also be tingling in the fingers.
Mm-hmm.
Diabetic neuropathy happens when the glucose in your blood is damaging the arteries and the capillaries in your feet and your fingers. So there's little arteries in your fingers, little arteries in your feet, and having a higher level of glucose is damaging the the capillaries that help keep the nerves healthy. So two things that you can do to help reduce or cure neuropathy. Number one is by lowering your blood glucose levels. So if you have a high A1C or a high glucose, like high blood glucose, if you have that number lower, that can also reduce your symptoms of neuropathy. But the other thing is, a lot of times neuropathy, once it happens, it's been too long, so it can't get fully cured. But you can have bad balance, you could have weakness in the muscles, your joints can become stiff and weak. So strength training and working on your balance and working on different lower body exercises can help reduce that. So neuropathy is one of those things. You can't do stretches to help your neuropathy. You can't get a massage to help your neuropathy. You have to exercise. You have to. That's the only way to help neuropathy related to diabetes.
Okay. My physical trainer, he
Hmm.
told me to strengthen the body strength, and which I do
Hmm.
exercising. And also, I do bicycle also about 20 minutes every day.
Hmm.
But sometimes I'm just sitting like this meeting which we are doing. And when I stand up and go in my kitchen, that time my tingling start in my leg. But after 5 minutes, it will
Hmm.
go away.
Okay. So have you been diagnosed with neuropathy, or has somebody just told you that?
No, I diagnosed with the pre-diabetic. My
Mhm.
A1C stays between 5.9 and 6.2. It
Okay.
depending on,
Yeah.
yeah. But
Yeah.
that's a
Okay. So
pre-diabetic. But I take metformin every day, 500
mhm.
mg.
Yeah. So I think like the way you're describing it, um, it might not be like diabetic neuropathy, that tingling or like that numbness you're feeling in your foot. It might be something else. So if you see a physical therapist, like one thing that I do is I try to figure out is if the numbness, tingling you're feeling in your foot is coming from the nerves in your back. It could
Mhm.
also be coming from tight muscles down here, or it could be the neuropathy from diabetes. So there's different tests that you can do to figure out which thing is causing that numbness. And if it's coming from your back, you can treat your back. If it's coming from your leg, the leg muscles, you can treat that. If it's coming from diabetic neuropathy, you really can't treat it directly, but you can indirectly improve your symptoms. So it's really important to know why that numbness is happening at all before you treat it. And seeing a physical therapist is the best way to work on that.
So how can you? Is there any test for the neuropathy diabetic?
There's tests for everything else. So basically, what I mean by that is like you can test 5 different things, and if all of those are negative, then there's a chance that it's diabetic neuropathy. But if you test 5 different things and 2 or 3 of them are giving you symptoms, you can very easily start treating that and see if your diabetic neuropathy improves.
Okay.
So um, there are tests to check the numbness, and there are treatments that you can do to help the numbness overall. Yeah.
Mhm. And second thing you talk about weight loss. Now, I
Mhm.
tried so much, but I have a problem with the weight loss. How would I improve
Mhm.
that?
Yeah, that's great. I think this topic is very important, and a lot of people have trouble with their weight or managing their weight. Um, the only thing that is proven to reduce your weight or to lower your weight is by eating fewer calories. Okay, so how much you eat is a big part of how much weight you lose, but the important thing is the stronger you are, the more muscles your body has, the more your body is going to burn calories just by resting and by being active and just like by resting. So what I mean by that is you like somebody can, so I weigh 140 pounds. Okay. So I weigh 140 pounds. My dad weighs like 145 pounds. But if you look at both of us side by side, we look very different,
Mhm.
right? And you can have another, like one of my best friends is 135 pounds, but he's much bigger than me. His muscles are so much bigger than me, right? So you can have 140 pounds and be very strong. You can be, a little strong, or you can be chubby and a little bit of overweight with 140 pounds. So you can have many different sizes in the same weight. But the difference is if you're 140 pounds and only have a little bit of muscle, when you're resting and when you're sitting and when you're sleeping, you're only going to burn a little bit of calories. If you have more muscles, you can be the same 140 pounds, but if you have more muscle density, you're going to burn a lot more energy just by resting and by sleeping. So, what I mean by that, the best way to lose weight is definitely related to diet, but by getting stronger and having bigger and more dense muscles, you will also lose weight faster that way in a healthier way.
How you make your muscles strong?
By strength training, by exercise. That's
Mhm.
the only way to get your muscles stronger. And for that, you should work with the physical therapist because they can figure out what's the best way to get your muscles stronger and the healthiest way to get your muscles stronger.
Dr.
Thank you.
You're welcome.
Anyone else have any questions?
What?
Nope. Dr. Bhavik, I don't see.
other-
One
Oh.
more thing, can I ask you?
Go ahead.
Yeah, of course.
How to lower the BMI? My BMI is always high from very beginning.
Yeah, so BMI is a calculation when they look at your weight and your height.
Right.
So the only way to lower your BMI, there's two ways to lower your BMI, either getting taller or by lowering your weight. So those are the only two ways to change your BMI. So in your situation, I think it's going to be related to weight loss, and it's going to be related to getting your muscles stronger so that your body is better at losing weight. It can lose weight a little bit better and healthier and faster if your muscles become stronger. Then your BMI. So like for the people that don't know, BMI stands for body mass index. And if your BMI is higher than 25, 25 to 30 is overweight, 30 and higher is obesity. Okay. A healthy BMI should be between 20 and 25. So my BMI is like 23. Okay. So that's like for my height, if I weighed 10 pounds heavier, I would be overweight. If I was maybe 12, if I was 12 to 15 pounds heavier, I would be overweight for my height, right? If I was 20 pounds lighter, I would be underweight for my BMI. So it's just a calculation. You just have to like adjust your weight to your height. And the best way to adjust your weight is by exercising and strength training. And the main benefits are of strength training. When you're stronger, even when you're resting, your body is going to burn calories and burn weight faster than if you don't have the same muscle. So you can have 140 pounds of a person. One person can be very strong. One person can be very chubby. When they're both sleeping, the really strong person is going to actually lose weight just by sleeping, and this person is not going to lose that much weight. So by resting, by like sitting, by doing nothing, the more muscles you have, the more calories your body is burning. If you have less muscle, your body is burning less calories and less weight even at rest.
Thank you.
You're welcome.
Hello, I have a question. Okay. Hello.
Yeah.
Yes, regarding
Yes.
for the people diabetic, for the rice, there are parboiled rice, brown rice, and regular basmati rice. Does it make difference to have the brown rice and parboiled rice than regular one?
Yeah, that's a great question. Usually speaking, if you have anything white rice, anything like that, it's actually going to be worse than if you have anything that has like whole grain, whole wheat. So brown rice is actually like the whole grain version of rice. So eating brown rice as a substitute for white rice is definitely a healthier option if you have high blood glucose levels. If you have pre-diabetes, anything like that, eating brown rice is definitely healthier.
How much?
And
How much
even
is
like
going to be?
even that is not a question that I can answer. You need to specifically talk to a dietitian on quantity, what quantity is good for you, because your body is going to be different than my body. It's going to be different than my patient's body. So the important thing is, number one, if you're eating any kind of carbohydrate, like even like bread, if you're eating white bread, that is not as good as eating whole wheat bread or multigrain bread. If you're eating white rice, that is not as good as eating brown rice. So that, like, number one, the making that change is something that most people should do. But how much of it should you eat? You need to talk to a registered dietitian to tell you how much of it you should eat. From how, knowing how my parents eat and knowing how my family eats, you know what, in one plate you're gonna have rice, you're gonna have some vegetables, you're gonna have some roti, you're gonna have some dal on the side. But it's usually more rice and more roti, less dal and less rice, and less vegetables. That's usually how we eat, right? So it's got to
Yes.
be different. Half of your plate needs to be vegetables, right? Half of your plate needs to be vegetables. A little bit of it, like the 1/4 needs to be some kind of protein, and then 1/4 of it can be carbs. So using either
Yes,
rice or roti, usually if you're
of
taking
course.
both, it's
Sure.
usually too much.
Okay, thank you. Thank you very much.
You're welcome. I see a question. You can unmute yourself.
Okay. Can I
Yeah, go
talk,
ahead.
Shilu? Yeah.
Yeah.
Okay. As I had a car accident while crossing, the car hit me on my right thigh, and it was a you know multiple fractures and everything. I had about 5-6 surgeries. I'm okay, and I took a lot of physical therapy all this time, but still I lost a lot of muscles on my right thigh. So while I walk, I feel that my both the sides of the thighs are, weak, and I need to stop a little bit and then start walking. So I want to improve my muscle strength on my right side and the left side thighs, so I can walk straight and strong. I know I need to get stronger while walking. So that gives me even little bit imbalance also. The balance also required because of the no strength in my thighs while I'm walking outside. So what kind of exercise I should do to improve that?
When's the last time that you saw a physical therapist?
In 2 months ago, before these things again, this started
Good.
New
And
virus.
Have you done any kind of do you do exercises with your physical therapist?
Yeah, I had been going to physical therapy for all this time.
No, but like what kind of what do you do when you're at physical therapy? What do you do at the therapy? What are the exercises that you do?
For the balance and also for the legs and cycle, bike, and
Okay.
And walking.
Okay.
And I walk also about 10-12 laps. Yeah.
When you're at physical therapy, do you feel like your muscles are getting tired and getting stronger?
I don't feel that tired, but when I walk, that time I feel my muscles are weak and I'm not getting enough strength to walk continuously.
Yeah, I think the main thing in this, so number one, let's connect this to diabetes, okay? So if you have diabetes or pre-diabetes and you get into a car accident or you get an injury, your body is actually going to heal slower.
I don't have the diabetes.
An injury that might, I know, I'm just connecting it to this topic. I'm just giving it this for everybody's knowledge.
Right.
One of the reasons, if you have diabetes, your body will heal less fast if you have an accident. So that if you have a cut, if you have a broken bone, if you have anything, if you have a ligament tear, your body will actually heal slower. So that's one big motivation for everybody here to fix your diabetes. Okay. Now, if you have, weak muscles and if you have poor balance, the only way to improve that is by really, really working hard. So when I work with patients and when I do therapy with patients, they're sweating, they're working hard, their heart rate is working faster. And if you're not working that hard, you're not going to change your body. So while bicycling is important, balancing exercises are important, walking is important, if you're trying to get stronger, your body needs to really put in a lot of effort. And what I mean by that is, like, on Thursday, I had an appointment with a patient here, and he had like back pain, he had leg pain. And after my exercises with him on Friday and Saturday, he emailed me saying, hey, my legs are so tired, I can't sit, everything is sore, my thighs hurt, my butt hurts. And I'm telling him, this is really good. That means you did exercises the right way. So if you're exercising with your physical therapist and you've never felt that level of muscles working, then you probably didn't exercise hard enough or heavy enough. So my advice to you is, if you're seeing a physical therapist, you should tell them, hey, I don't feel like this is strong enough exercise. And can you show me stronger exercises? I think that's important.
So can
And
you,
all of these
is it
exercises you
possible
can
for
do
you
at
to
home.
show me? Is it possible for
Yeah,
you
we
to
would
show
have
me
to
some
do,
of the
yeah,
exercise which I
absolutely.
can do it at
We
home?
can't do it. We can't do it like this. We can't do it like this. I would need for you to, like, become a patient. I would need you to sign some, intake forms, just because I need to know your whole medical history before I can teach you exercises that are good for you. This is something that I work with people online all the time. My practice is a telehealth practice where I can teach you how you can exercise in your home with your equipment, and you will get the same level of exercise as you can in the gym. If you go to the gym and you exercise with all the machines, I teach people how they can do that same type of exercise at their home. So I can definitely teach you. It's just inappropriate for me to do it in this kind of, group format. I would need to do that one-on-one.
Okay.
So we can schedule.
See,
You can give me a call, you can send me an email, and we can schedule it.
Yeah. Do you see this machine I have at home?
Yeah.
Can you see
Yeah,
it?
I see it. Yeah, I can
Is
see
it good enough?
Mhm.
Yeah.
Again,
It's
that
just
machine
like
is one machine. That's one machine is good for
right.
one exercise. That is not enough. That is good. It's not enough. You have to do a lot of exercises besides that. That's one exercise. That one exercise is not enough to get stronger, because you can't exercise every muscle on that machine. You can exercise maybe one or two muscles, but your body has like 200 something muscles. You need to exercise different ways for each muscle.
Pragnanti, Dr. Bhavik is going to share his contact information. You can contact him separately so that he can guide you more.
Yeah,
better.
right. Okay. Thank you.
Thank you. And
Yeah. So if anybody has any questions like this, if you want to learn how to exercise, properly for your body and yourself, you can call me. This is my phone number. You can send me an email address. You can send me an email over here. Talk to me and work with me one-on-one. I can really show you specifically for you how to exercise. Yeah. So everybody should just write down this phone number, write down my email address. Yeah, and I would love to work with you guys. So please let me know.
yeah, I can repeat the phone number. Pragnanti, you're on mute.
Okay, the number is very light. Can you?
Yeah, we'll repeat the number. Please note it down. It's 718
Okay.
308
3 what? 3 what?
308.
308. Okay.
5225.
5225.
Yeah.
Okay. Is there any particular time and whatever the email address? I can,
Auntie G, are you in the, India home group? I'm going to post this information there.
yeah,
So
yeah.
you all can
Okay.
access it. I have his phone number and email address. I'm going to post it there so that you
Okay.
guys all can note it down.
Okay, thank you.
Thank you. Bhavik ji was screening. Yeah. I have the picture of your information. I can share it in the group so that everybody can note it down.
Okay.
Yeah.
Good.
Thank you. Is there any other questions or?
Yes, I have a question.
Yes.
Okay, for foot neuropathy, what exercise is the best?
So the thing with foot neuropathy, it's not, there isn't like one or two exercises that are the best. You have to look at your whole body and see what muscles are weak. So with foot neuropathy, some muscles that bring your foot up might be weak. Some other people, another muscle might be weak. So there's a whole combination. So like with anything, you can't, it's not something as simple like, oh, if this is what you have, then you take this. That it's not that simple. That's why doing a full evaluation and finding out which muscles are weak for your body and then exercising all of those muscles. Usually there's like 7 or 8 muscles that are weak with people, so we need to exercise all of them. But your exercises might be a little bit different than somebody else's exercises. So the hard thing for me to do, I can't give you 1 or 2 exercises. That's not going to help your neuropathy. You need to work on a lot of muscles.
Okay, one more question. That's is it they
Yeah.
get cramps in the leg if they have a diabetes?
Yeah, so that's more common. That's a good question. It is more common to get cramping in your feet, in your toes, in your legs. If you have diabetes, it is more common to do that. And the best way to reduce the cramping is by stretching and exercising. So the more flexible your legs are, the more flexible your muscles are, the less it's going to cramp, and the less strong it's going to cramp also. So stretching is the best way for that.
Okay.
That's it.
Yes, I think the time is done.
Any other questions?
Any questions?
All right.
Please unmute yourselves.
Thank you.
You can raise your hands too, like. I don't see anyone, Bhavikji.
All right. Good. If there's no questions, it was great talking to you all. I'm going to record this and put it into my YouTube channel if you want to share it with anybody. If anybody has any specific questions on what exercises you should do, please give me a call, send me an email, and we can figure it out individually. This was more to just teach people about what diabetes is and how much it can impact your whole body and not just 1 or 2 things. It can affect many different things. So please talk to your doctors, get your blood work done every year. Very important to talk to your doctors about this.
2
times a year.
So
It was
thank you.
very informative there, Dr. G. If you can share your YouTube link, like we'll share with our members so that they can watch it. Thank you.
Thank
Thank
you.
you.
Thank you,
All right.
Bhavik.
Thank you.
Thank
Thank
you.
you, Bhavik Doctor.
Thank you.
Thank you.
Bye.
Nice.